part 2 of our webinar on the topic of potty training for SATB2 families. We're joined again by Dr. Amanda Thompson, who is a physical therapist that specializes in pelvic floor, women's, and pediatric physical therapy. Amanda's going to cover getting started. What do we need to do to prepare for this big potty training adventure? So join me as we learn more on this topic of potty training.
Welcome back, everyone. Thank you for coming back for part 2 of the potty training. We're going to start with a little bit of a review, and then we'll go through readiness for potty training. I'm going to share my screen, so bear with me. Okay. So, part 2 of the potty training. We're going to review some of the bladder irritants, and again, I'm going to make them accessible to everyone, but I'm going to run through most of them. Some of them will apply to everyone, and some might only apply to some children. So it's depending on how old the child is, and some of us are actually talking about adults or young adults that might be eating or drinking some of these things that we're going to be working with. So if your child or young adult is drinking coffee or any caffeinated beverages, that's going to be a bladder irritant. Any chocolate is going to be a bladder irritant, as well as medications with caffeine in it. One of the biggest ones is migraine medication, but if you want to talk with your pediatrician about any specifics, if there is any caffeine in your medication, that would be good to talk with your pediatrician about. And then there are some things that are irritating for most people that might be irritating for me, but might not be irritating for you. So acidic foods, citrus juices and fruits, tomatoes and tomato-based products, artificial sweeteners, highly spicy foods, milk and milk products. We talked about milk and like ice cream and stuff at the end of the day last time. Sugar and honey, corn syrup, and cranberry juice. So sometimes a lot of my kids that are not potty trained, sometimes it's for several different reasons, but cranberry juice, a lot of people use to prevent UTIs. And the point of the cranberry juice is the sugar and the juice will irritate the bladder and stimulate the bladder to urinate more frequently. So if you're using it as a prophylactic to prevent anything, then you're doing yourself a disservice. Some alternatives for if your child doesn't like water is grape juice, cherry juice, apple juice. For my patient population, especially for bedwetting, apple juice is not good for them. I think it's the vitamin C in it. And then prunes, plums, and water. Again, you want to make sure your child is drinking half their body weight in fluid per day. That will help with bladder, not having a dehydrated bladder, which is a bladder irritant, and helping with constipation. Again, back to constipation, we want to make sure our child is having an adequate amount of soluble and insoluble foods or supplements. And then we will jump into part 2. So where are our choices? So we have 2 choices when we're going to potty train. We have a long way and the short way. The long way tends to be a little bit better for our older child, not like older, I would say 8 to 10 and older, or early adulthood. This is a non-intensive, it's a throughout the day over several weeks. It can take several weeks for this to occur. And then we'll kind of jump into long and short in a little bit. The short way is intensive. So it's 5 to 10 days, sometimes a little bit longer depending on the child. And it's usually typical for children under the age of 5. You can try the short version, the intensive version, whenever we get to it, and see if that works best for your child. And it's all going to be based on their communication level and motivations, which we'll get to. So we talked a little bit last time about the anatomy of peeing, but we're going to go through some verbiage and some different words that you might hear people say, especially on the internet. So voiding, urination, peeing, it's all the same thing. The anatomy, the kidneys will make the urine. They go from the kidneys to the bladder via a tube, and that is involuntary. You can't control that. It happens as your body detoxes and absorbs nutrients. Involuntary from the kidneys to the bladder. But from the bladder out, male or female, we have voluntary control, meaning we can control whether we let urine out or hold it in. There are sensors in your bladder that I always tell people, I give them a blanket number. So it's not 100, but we're going to go with 100. So like, let's say your bladder will fill up to 100. When you get to about 50, your bladder sends a signal to your brain that says, I need to pee. And then you're like, man, I don't really need to pee. I can hold it. So you get another signal when it gets to about 75. And you're okay, I really need to pee. The closer that gets to 100, your brain is like, I have got to pee right now. The trick is finding the sensor from the bladder to the brain is a muscle and a nerve thing that we have to learn. And so learning that is going to take time and effort on both parties. And then we have to learn to relax the muscle. So if we can't relax our muscles, then we're going to have trouble peeing and pooping. But the muscle is the key when it comes to teaching potty training. Oh, I should mention, most adults cannot find this muscle. This is why I still have a job. Most adults cannot find the muscle if you say, okay, squeeze the muscle to pee. So I think it's challenging for all of us to figure out where that muscle is and how to activate it. So learning, the child actually has to learn to squeeze the muscle or hold the urine in. So a child cannot figure out what that muscle is if you're like, just hold your muscle. They don't understand that. They also have to learn to relax the muscle at the right time. So if they cannot relax it at the appropriate time, for example, they get the urge to pee, but they can't make it to the toilet, they sensed too late in the process. There also is the counterproductive part of it. So let's say my child holds it all day long. They are dry all day long, and they pee at night. So they have bedwetting issues. That's because their muscles are holding all day long, and by the time they go to sleep, they finally relax their muscles and they pee in the middle of the night. Okay, preparing to potty train. So if you are concerned about any medical issues about training, talk to your doctor, pediatrician, or any specialist that you're seeing. There is something called a neurogenic bladder. That is something completely different, that if you do have that, it just need to be seen by a specialist, probably a pediatric urologist. And I do have some really good ones, at least in the Fort Worth area, that I have really good connection with. If anybody is in the Fort Worth area, they're very hard to find. But I do work with the Cook's system. Frequent UTIs, so if your child's always experiencing UTIs, bladder infections, or if they have a kidney disease, you want to consult your physician before you're trying to do all this on your own. And it might be something that a PT like myself in your area needs to address with you to give you an individualized program specific for you. So are you ready? So of course you're ready. That's why you're tuning in. So are you frustrated? Again, of course you're frustrated because you've probably been trying anything under the sun to get your child potty trained. It's just not working. This potty training is not behavioral, it is instructional. So all the work should be rewarded. The rewards should come for the student or the child, young adult, whatever age that we're working with, but we also need to reward ourselves as the teacher. So the teachers, the mom, or the teachers at the daycare or the schools, teachers, the dad, or both parents, you need to find rewards for yourself. Planning. So the biggest part of this is who's going to be doing the training. So if it's going to be multiple people, let's say we have a school-age child and they're in school. So is it going to be primarily the school-based system, or is it going to be daycare, or is it going to be you at home? So if they're under the age of 5, typically a week or 2 of work will be successful. Sometimes it's up to 3 weeks for the older kids, but hopefully not too much longer than that. The other thing is you want to find the time that works best for you. Maybe the middle of the school year is not the best time for you. Maybe Christmas break, y'all are doing a lot of traveling. And if this isn't something that's a dire need, then we need to find the time for you, because both parties are going to be affected if you're consistent and then non-consistent with And it's work. It's work for both parties. So you have to be prepared to put in the work. And then where will the training begin? I just said that. So some will do both at home and at school, and getting the school system in place with you will be helpful. It is possible that they may be potty trained in one place and not another. So it might be possible that your child goes to school and is completely potty trained throughout school, but as soon as they get home, they are not potty trained. And so that's going to be another instructional, which we'll dive into in a little bit. And it's not necessarily to do both at one time. So you can focus on one, daycare or home, school, and then focus on the other. So if it's easier for you to do it at home, then do it at home, and then we can proceed into doing it at school. Getting ready. This is lots of getting ready. So when you're ready, the diapers have to go. The pull-ups have to go. Anything absorbent has to go. The biggest reason is the child might actually hold their pee all day long because they don't have the diaper to pee in. And especially as they get older, it becomes their safe haven. I've worked with children that have a lot of bowel issues as well, and they will not poop in the potty. They will only poop in their pull-up or diaper, and they're older children, 7, 8, 9. And so by working towards getting it completely gone is going to be key. They cannot tell when they need to pee. You cannot tell when they need to pee or when they're wet. They can't tell. You can't tell. You can feel their diaper, but at this point, we're trying to train them. Underwear is needed. And my screen is, let me see if it'll share. Hope it will. But if your child is going to school, you want to make sure that you're not making a point to make them embarrassed. Obviously, at kindergarten or first grade, kids will have accidents, but as they get older, it can significantly impact their ability to make friends and the community aspect of it. So having waterproof pants is going to be helpful, as well as communicating with the teachers and the aides. Where do I get them? So this link, which is when you get the PowerPoint, you should be able to click in this direct link. This is a Canadian group that has these waterproof underwear. I tried to put the Amazon one, but the link was like this big. So if you go to Amazon and search Gerber waterproof pants, then the waterproof pants pull up on there. And that's, once you figure out a little bit more into this, you'll be able to figure out which way is going to be best for you and prepare for. All right, we're still getting ready. We're trying to figure out motivation for the child. So sometimes people will use any kind of motivation, iPads, candy, food. The biggest thing is it has to be something that is only accessible and only provided when you're potty training. So if it's like sweet tarts or something that they might get throughout the day, or for good behavior, or if you're working on a behavioral chart, it has to be something that they don't get all the time. The other thing is finding that child's motivation. So every child is different. So there's so many different ways for motivation, and hopefully whenever we get this popped up, we'll be able to answer some just good examples of motivation. Toys, a toy box. So if you want to do like I don't know, people get really creative on Pinterest, but if you get just like a box of like little dollar store toys, that's their potty box, and basically if they potty in the potty, then they get to choose a small toy from the box, or crayons or colors or whatever that child is motivated by. And it has to be specific for them. That's the key. It can't be just what any child would want. If you are really excited, yay, you peed on the potty, yay, you pooped in the potty, that's not necessarily going to be specific for pottying, because as we are getting the child to have different areas of their life that they're excited about, or we're motivated that they are maybe speaking for the first time or walking for the first time, you want the praise to be there, but you also want to have another motivation in it, because our children are needing some supplemental motivation in order to be potty trained. Let's see, grab toy box, food, and it has to be contingent to what you are wanting. Highly motivated for individual, and again, that they don't get any other time except when they go to the bathroom. Okay, the other thing is there's all the little baby potties that you can get online. I'm not a fan of them. It's just simpler to not have to train on the little itty bitty potty and then have to transition to an adult toilet. So if you go ahead and transition, like start with the adult toilet, you're gonna need a couple things besides a little potty, and everybody's individual. So if you don't feel like that's gonna work for you, or maybe it's worked for you and it's just not convenient for you, then this is gonna be one of the big things that we'll work on is actual potty training. But the key is the toilet has to be comfortable. So I work with a lot of children with a lot of different disabilities. So there's a lot of things that have to be taken into consideration. Depending on your child and how much mobility they have is going to be kind of where we need to tackle the toilet accessories, as we say. So toilet has to be comfortable. If the child isn't comfortable pooping or peeing, then it's not going to be, they're not going to want to do it. So they have the inserts that sit on the toilet. They have these lids that go on the toilet. That's the toilet seat for adults, and then you pull it down and it's a little baby seat for the little children. A stool for them to step up if they're smaller. And then do they have trunk control? So if they don't have very good trunk control, or maybe they're like moving around a lot, they're not going to be able to sit safely and be comfortable on the potty. So there might be something that you need to work with your occupational therapist or even a physical therapist or your physician to help with that. There are seating devices, there are support systems, there's railings that you can get. The other thing is the boys and girls. So boys, I mentioned last time that sitting, I like to teach sitting first. It's easier to relax. So you might actually be training pooping and peeing at the same time, and you obviously don't want them to be pooping while standing up. It is easier for them to relax, and it's a little bit easier to train. And then once they get really good at it and get good at that signal, then you can teach them to stand. Because the standing position is actually not just standing. They have to have really good trunk control, and they kind of lean back onto their hips and their pelvis. And they actually sit on what's called the Y ligaments of our pelvis to pee. That's the only way they can relax their pelvic floor efficiently in order to be able to relax their pelvic floor to pee. So sitting down, they're going to be able to relax. Just make sure we're pointing down and teaching them to point down. So whatever verbiage you want to use for that is going to be helpful. Poop training occurs at the same time. Depending on the level of function, you want to think about the older children. So let's say you're training an older child that's going to be in middle school, high school, or older, and you want to teach them to maybe sit down to pee because they might be made fun of with other children. There's going to be a whole behavioral thing that's going to take into account. So if a child goes into the stall in the boys' bathroom and goes pee, nobody's even going to question it. But if the child's standing at the urinal having trouble or not being able to figure it out, there might be some other more public things that we don't want to worry about. So it also depends on how your family dynamics are and how that's going to work. And you can always talk to speech therapy, occupational therapy, and physical therapy to get some good ideas on how we want to start with them as well. Okay, we're still getting ready. Communication. So I work with a lot of different children of different ages and different verbal abilities. So we need to figure out what communication we can use for your child. So if your child is verbal, you always want to model the question. So do you want to sit on the toilet, bathroom, pee, poop? You want to use those words so you know what they're wanting or doing. Even if it's not 4 or 5 letters, but if they can specifically say whatever you want to say, number 1, number 2, whatever words you want to use for the verbal children, that's going to be key to model it. And just like modeling any other behavior is going to be key. Again, speech and occupational therapy should be able to help with the modeling behaviors, and physical therapy as well. There's not a lot of physical therapists that do potty training, so hopefully I'll get some questions on here. Your nonverbal question, or your nonverbal children or young adults. So if you want to work speech therapy, always tends to have all the really creative stuff. So little pictures like the ones that are Velcro on the back, and you can have them kind of off to the side, a picture of a toilet that you can they can keep in their pocket, if they can just one or two or however you want to do it. The little pictures or you can have a board for it. However, the best communication is that you're already doing, or talk to your speech therapist about some options for helping you come up with a communication tool for your child. So signing for toilet. So toilet signing is the T in circles, toilet. Bathroom, B, circles, is bathroom. So if you want to teach them, you need to go to the toilet, and they might, yes or no, or they might sign back and they might not. But what is the resource that you're using for yes or no questions that you can communicate with that child? What's their communication back to you? Again, toilet, bathroom, T's and B's, and then circles. And then again, we have school versus home-based communication. So you have to take into consideration as we train, especially children that are going to have more behavioral deficits and or children that are going to be less verbal. You don't, in theory, as they get older into early adulthood, you don't want them to, at school, you want them to ask for the potty. I need to go to the toilet. I need to go to the bathroom. But at home, eventually, you don't need to tell someone that you need to go to the bathroom. So the way that the world likes to revolve around the communication is getting a good communication early on, but then teaching the child that it's okay that you don't have to tell me every single time you need to go to the bathroom as we progress through this. Obviously, at first, we need to be practicing that communication that they need to go potty. Early on, we're going to be making them go, so it's not going to be as difficult early on. Goals for next week. So we're going to do another one next week. But the biggest things I want you to work on is thinking about your specific motivator for your child. So whatever that may be. And hopefully we can get some pop-in links on some examples, and maybe one parent might have an example that another parent can use. But finding your child's motivator, what's going to motivate them that you can keep either in the bathroom or immediately after they use the potty, that will be specific for potty training. And then the second goal is for you to find a communication that your child will be appropriate for. So again, it might be talking to a significant other, a caregiver, a nurse if you have nurses with you, something that you already use for communication that we can modify for toilet training. And then next week, we'll go over going potty, number 1. And so we will try to get probably 3 more sessions is my goal. So if anybody has any questions before next week, please pop them onto the bottom, and I'll try to answer them either before or at the very end of each webinar. And I hope you enjoyed, and we will see you next week. Bye.